This week in Grace's Girls Club, I have a very special guest with me. I want you to meet Michelle. Michelle, thank you so much for being here today. Please introduce yourself. Tell us a little bit about you and the company you work for.
Great. Thank you so much for having me. I'm excited to talk to all the young ladies. My name is Michelle Brown. I'm the Chief Operations Officer at Clearview Cancer Institute. I'm also a nurse practitioner by trade, so I still see patients as well as the administration side.
Okay, I'm glad you brought that up because I was actually going to ask you if you still saw patients. So you are acting COO and still have a patient list at the same time?
Yes, not every day. So I do more of when we fill in, we have right now 50 APPs. So APP stands for Advanced Practice Providers. So that could be nurse practitioners, RPAs. And so if one of those are out or, emergently, or if we have a new process that we put in, then I like to go see the patients and make sure that, the process works well, or I always want to cover our APPs if they're out. So.
How incredibly cool. So about how often, how many days a month would you say that you work as a practicing nurse practitioner?
Well, here recently, I've been working at least 2 days a month seeing patients. That actually is my favorite. So I love spending time with patients. I love spending the time to educate them to make sure they understand their diagnosis. So, as you know, in the cancer field, it's very scary. So when they first come in, they have no clue what's going on. And so just being able to take the time and explain to them what actually is their diagnosis and then walking them through there are treatment options. And there's lots of treatment options now. And that's the great thing about the field of medicine, and that they will be okay. And there is hope. And just watching the patients go through the trial as well as with the family and watching the strength of the patients. That's what really inspires me as well as all the people that work at Clearview. And that's why we continue to do what we do.
Wow, absolutely incredible. I just got chills. So if that's the nurse practitioner portion of your role, walk me through the portion as COO, as Chief Operating Officer.
Sure. So, as the chief operating officer, basically anything that falls under operations is what I'm in charge of. And that kind of can sound daunting, but I have a good team with me with our CEO, who's amazing. He's a PharmD by trade. And then we have a great CFO, we have CIO. So, there is a team of executives that's kind of helping. And so, with my background being clinical, I focus a lot on the patient side. So, any patient process, from the time they walk in and go to lab all the way to the end when they're checking out. Anything like that falls under me. And so basically in the operations world, what we're trying to do is make sure that we have the technology that's needed, the processes in place, and of course the people. And we spend a lot of time in selecting the right people because you want to make sure that the people that are there for the right reasons, right? So you don't really go into oncology just thinking about a paycheck. You go into oncology because it's your passion and that you want to help and be there for the patients and help make a difference. And I feel like every one of our employees do that to the highest level possible.
Wow, you must be such a blessing to the people that you work with.
Oh, well, thank you. I love it. I started out as a nurse practitioner in 2006, and I was working with Dr. Paulding and Dr. Mandang, and it was the greatest. I came from a surgical trauma background as a nurse, and
Mm.
so I thought that's what I wanted to do. And then when I started seeing patients in the oncology world, I really kind of thought it was going to be temporary, but then I fell in love with the patients because in the surgical trauma world, you really don't get to have a relationship with the patients. And that's really one of the best things out there is to just be able to talk to them, but also the family, because the family's going through it as well. And, there's a lot of emphasis on patients, but the families are suffering just as much, but they have to stay stronger because they don't want the patients to know, what they're feeling and going through. So we try to take a lot of care of we try to take extra care of our caregivers as well so we can keep them motivated to help take care of the patients.
Oh, of course, of course. And I got to tell you, you must be a tough cookie. It's surgical trauma and oncology, those are not for the faint of heart.
I I love it. And so, one message I would like to give to the ladies is that in the world of nursing, but really in the world of medicine, but specifically nursing, you can do anything. I've worked in surgery, I've worked in surgical trauma, I was post-op, you can do general medicine, you can work in a doctor's office. But now, like at Clearview, we have research nurses, We have nurses that are our patient navigators to kind of help navigate them through. We also have nurses in our compliance department. We have nurses in quality. So really in the world of nursing, you don't have to just be what people think about in the hospital at the bedside. There are so many opportunities. And, just within, my world, I've been able to just continuously change and evolve. And so I really recommend uh, the field of nursing. So.
Absolutely. It sounds like it's incredibly versatile. And I completely agree with you. Now, where I am, I had all these friends that went into college as nursing majors, and they all wanted to do hospital bedside. And now they're all working for anesthesia, or they work with pediatrics, or they're travel nurses, or they do all kinds of different things. So I think you absolutely hit the nail on the head. I wanted to go back to something you said earlier. You talked about the importance of technology. Obviously, that's a key role in what you do, but I know it's not the only thing. Of the letters in STEM, science, technology, engineering, and math, other than just that T, but that included, which would you say most applies to your role?
So of course, in our world, science is, the major facet, and then technology is really increasing, in the world of medicine. Math is always the backbone, especially, math and science goes hand in hand with chemistry and producing our drugs. But I would say science, and it's always evolving. And so that's the other thing, when we hire nurses and when we hire our APPs, we tell them it's a constant learning. It's not like you're out of school and, you'll never learn again. You're constantly learning. So we're always in a continuous learning mindset. So you never
Absolutely.
get bored. It's amazing.
I would assume that that would have to be true. So if I
Yes.
was a young girl or just a young student in general, and I thought, okay, maybe this is what I want to do. Maybe I want to be a nurse. Maybe I want to work with an oncology support program. How would you tell me to get to where you are educationally? Walk me through the educational path that you took and what you might recommend for others.
Sure. So I initially got I initially got my bachelor's in nursing, and I worked as a nurse, which I recommend doing before going back. And then went back and got my master's in nursing. And so you need your master's in nursing in order to be a nurse practitioner. And so I worked there for a while. And then when I moved into the administration side, I then went back and got my MBA. And so that's a master's in business administration. And so that way I can understand the clinical side as well as the business side. And I think that's what has helped make me successful in my role. From a nursing standpoint, you actually can just have an associate's degree. It's a 2-year program. And I know Calhoun, that's here locally, they have an amazing program. But then if you did want to become a nurse practitioner, you do have to have a bachelor's first. There's lots of different programs that's out there that kind of help step you through from if you just have an associate's up to master's, or you can do associate and then bachelor's and then master's degree. So a bachelor degree takes you 4 years and then another 18 months for your master's degree.
There you go. I really, really like the versatility of the nursing field. I mean, aside from just the different aspects of the career you mentioned, now the different ways you want to approach it educationally, I think that's why it probably appeals to so many people and it makes complete sense.
Yes. Yes. And so if anyone is interested, I'd be more than happy to talk to them.
Oh, thank you. I appreciate that. I do get emails from time to time, so I'll keep that in mind to pass on your information if there's any future nurses out there. But I wanted to ask you, aside from just the versatility of the field, what made you interested in nursing in the first place?
So interesting story. I was actually pre-med, and my father was diagnosed with what we thought was cancer, and so I did not want to leave my mom with him. So I then decided to go into nursing for the period that we thought, that he was going to be in treatments and things like that. Good news is he was misdiagnosed, and so then he lived for another 10 years. But then I fell in love with nursing. So I've always had the drive to want to help others. Even when I was young, I was always putting Band-Aids on everyone, always taking care of the family. So I've always had that drive to take care of them from a medical standpoint, but then also just the relationship side. I would recommend, in any field to go spend time, and at Clearview, we allow shadowing, and we allow internships during the summer. So I would recommend for anyone to kind of just go shadow and make sure that's something you want to do. And again, there's so many fields. There's radiology nursing, there's radiation oncology, there's medical oncology like what we do, just in, the world that I live in. So there's lots of options. But I think you do need to have the drive to, want to care for others.
Absolutely. So what is the best part of your job?
The best part of my job is the patients, of course, and especially when we have bells in all of our centers. And so when they get to ring the bells saying that they've completed their chemotherapy journey, it's the best day, and just watching them live their lives, and even for the ones that maybe can't have a curable diagnosis, they really start living once they're diagnosed, right? A lot of people put things on hold until they retire, until this or until that. And then once you're diagnosed, though, you don't know, right? And none of us really know how long, but just watching them live. And so we get to live through them. They go on all these adventures, they, make up with their families, and we just get to see all of that. So it's just amazing to be part of the patients' journeys. And every one of them is different. And in Huntsville, we get to hear lots of stories from our veterans. That's amazing to me. And just talking to them and the relationships that you form.
Wow, absolutely incredible. So, of course, I already know likely what you're going to say to this answer, but what are some of the challenges that you have to deal with at work, aside from just the fact that most of the time when you meet people, it's the worst or one of the worst days of their lives? What are some of the other challenges that you might face as COO and as a nurse practitioner?
In nursing, the hard part, of course, is talking to the patients about diagnosis, or about progression of disease. But then we also have to deal with insurance. And so, kind of more on the administrative side, insurance is constantly changing what drugs they will pay for, what drugs they won't pay for. A lot of the patients don't understand insurance. And so we're having to, make sure that they understand how much they have to pay out of pocket. And then we try to put programs in place because we never want someone to go without treatment. So I would say insurance, financial toxicity within, the healthcare world, but then also being able to just keep up with technology because it's constantly changing. So we'll put in something that we think is going to be great for 2 to 3 years, and then they come out with something new. And we always want the latest, greatest thing, right? Personally, but also in our workplace for our patients. So keeping up with the fast technology, products. And now AI is entering our workforce, right? And so
yes.
how do we want to use AI? And should we use AI? Cyber security has become a big issue. Healthcare in the past really kind of was in its own bubble, and wasn't really attacked. But now we're having more and more hackers trying to attack. So we're having to make sure we have lots of cybersecurity safeguards in. So just kind of making sure that all of those things are in place, but not letting the patients worry about any of that and just focusing on them with their treatment.
That's a lot. I would never have guessed about the hackers. I did not think, of course it happens, but I did not think it was as common as you just mentioned. And that was a great point about insurance. I saw something online the other day that said insurance companies and medicine is like toddlers and food. You give them blueberries on Monday and they love it. And on Tuesday, they act like it's the worst thing you ever gave them.
Yes, that's 100%. That's a great way, Grace.
So you might feel like you already answered this. If you did, just let me know. This is my last question for you before I let you get back to your busy and the wonderful difference that you're making. But your message to young women and young students in STEM. I know we talked about the great benefits of being in such a versatile field such as nursing. Is there another message that you had for them as well?
I would say don't be intimidated. You can learn anything. You can do anything that you want to. So any of the fields, of course, I'm more biased towards science, right, because of what I do. But anything that you want to do, you can set your mind to it and you can do it. And even if you are doing something and you get bored with it, the great thing is you can change, right? So there's all kinds of avenues that you can go down in the STEM world. Don't get discouraged. Don't feel like you can't do it, and don't feel like it's too overwhelming, because you can.
That is an outstanding message. I was one who, meteorology school is very math heavy and very physics heavy, so it tends to be fairly difficult. And I was so intimidated by the course load, and it ended up working out, but school intimidation is a real thing. So I'm really, really glad that you said that. I think that's an awesome message to our young people.
Well, good. Well, thank you so much, Grace. I appreciate you.
Well, thank you for being on. Michelle, officially welcome to Grace's Girls Club.
Thank you.
All right, Michelle Brown with Clearview Cancer Institute, thank you so much for being here. Have a great day.